started. Okay, welcome to our audience watching this video today. I am very grateful and excited to speak to some heroes that I have here in front of me. I have the pleasure of sitting with these medical care providers that have traveled to Gaza, and they have a wealth of experience that they want to share with us that I think is very important. Obviously, we're all aware of the genocide taking place in Gaza, and we're well aware of the humanitarian situation that is quickly collapsing. There is a famine, the medical system is broken, and you guys are all going to help us understand just how serious that situation is. And so I'm very, very grateful to have you all here today. And as I understand it, you guys are kind of going on tour speaking about your experience, right? And so there was an event in Gainesville, there's going to be an event here today in Tampa. And if I'm not mistaken, correct me if I'm wrong at any point, please, but you all went with the Palestinian American Medical Association, as well as the Jordanian American Physicians Association. And this organization essentially recruits medical care professionals willing to risk their lives and go to a war zone like Gaza to provide critical medical care. Is that correct?
Correct.
Wonderful. So what I'd like to do is introduce you all individually to our audience. So we'll start with Dr. Waleed. If you can introduce yourself, your specialization, and where you're from.
Hello, everybody. My name is Waleed Syed Ahmad. I'm a board-certified anesthesiologist with subspecialty fellowship training in interventional pain management, cardiac critical care. I've been in practice for almost 24 years as a physician. I'm a native of Egypt, but I live in the United States of America since 1995. I've been serving as the president of Atlantic Anesthesia and Spine Institute in Broward County in Florida.
Wonderful, thank you.
Hi everyone, my name is Bashar. I'm a pulmonologist and intensive care physician. I've been living in Florida for the last 6 years. I work in Gainesville, Florida. Nice to meet you all.
Hi everyone, my name is Amani Canaan. I am a licensed practical nurse and a therapist for over 13 years. I'm Palestinian American and originally from New York, but live in Miami.
Hello, everyone. My name is Rana Mahmoud. I'm a registered nurse who resides in Tampa for the last 27 years. I'm a Palestinian American, and I do critical care, and I also do wound care, and I've been to Gaza twice already.
So what I'd like to do now, before we hop into a presentation, because you have a wonderful series of photos and videos, wonderful in the sense that it does a wonderful job of presenting the situation, but obviously the subject matter is not wonderful itself. But I would like to hear individually from each of you why you would be willing to risk your lives and leave the safety of your homes to go assist the people of Gaza in this situation. So we can start with Rana.
Oh, okay.
And yeah, we can take your time as well. You know, we have plenty of time here today. I think this is an important question, so.
Okay. Honestly, like I'm a medical professional who basically I chose to go to Gaza. My first trip to Gaza was last year in May before the genocide started. So I already built that relationship with them then. So, but I chose to go honestly because the humanitarian in me, and I just wanted to provide some humanitarian aid. And as a medical professional, is just something like there was some sort of call for me to go to Gaza. And again, like I said, I started to build my relationship with them last year in May. And when the genocide happened, I already had built that bond. I really wanted to go to help out.
So since you went last year in May, and then you went again almost a year later, I think in March, correct?
My first trip was in January, my second trip was in March.
So you've gone 3 times then in the last year. You went May of last year, January this year, and then March.
Correct.
So you've gone 3 times. So you saw the before and after. So what was the healthcare system like before when you went last year in May compared to what you saw recently when you went back?
So last year was already a devastated healthcare system. However, they tried their best to make the best out of it with very little resources that they had, but they still did what they can to the best of their capabilities to work with that devastated healthcare system. However, right now with my last 2 trip, it was just, everything was just falling apart. It was a lot worse.
So Gaza prior to the genocide was already, the medical care system was overloaded, just did not have the resources needed to adequately support everyone, and now it's just completely devastated.
Correct, that is true. But however, like I said, even though like last May it was a devastated healthcare system, but they worked with every little bit of resource they had, because they had little resources. They worked with it. They were okay with it. Regardless, right now they have no resources. So those little bit of resources that they had last year, they no longer have those little resources right now.
I see. Amani, why did you decide to go to Gaza?
For a few reasons. Number one, as a medical professional, you just naturally want to be helping and I'm very passionate about helping other people, especially those in need. And another reason was watching what was going on through the screens of the TV and the, social media just made me heartbroken every day. And I just prayed every day that I could be part of there and helping in any way I could. And that desire became a reality, and I was able to join. I'm very thankful for doing that and honored.
And was that your first time in Gaza?
Yes.
Was that your first time in Palestine?
No, my childhood, I lived in the West Bank. I grew up there. I lived 7 years in the West Bank, in the villages near Ramallah.
Okay, I see. Have you ever provided medical care in the West Bank?
No, it was during my teenage years, so I wasn't in the medical field.
I see. Dr. Bashar.
I have 2 kids, a 5-year-old and a 2-year-old. And, going to Gaza, I have some personal reasons and some, common reasons that everyone have. A friend of mine, his name is Dr. Dabbour. May Allah have his mercy on his soul. He was a pathologist. He was one of my colleagues at the University of Jordan. We actually used to go to the library, study together. I was seeing him around in the library. I met him a couple of times. He's a few years ahead of me. And he was targeted along with other more than 400 healthcare workers that were specifically targeted. And he was killed at the beginning of the war. The uncle of my friend, Dr. Farwana, he was the dean of medicine. His nephew is one of my best friends. He's right now in St. Louis. He was targeted with 19 members of his family, including his daughter, who's a gynecologist. 19 members, more than 10 children were bombed in one house. All of them were murdered. So whenever you hear these stories and then you open the TV and you see all of these children that are being targeted right and left with explosive injuries and gunshot wounds, you just, you feel the urge that I need to try to help. I felt that this trip was a healing trip for myself, No matter how much help I can provide there, it felt so little to the amount of the devastation that they have there. So it felt like a healing trip for myself, to be able to be part of, of trying to help and, minimize the suffering that they are going through over there.
Mm. When you say targeted, so this doctor you're referring to with his family, and there were 19 people in the home, I'm assuming there were so many people in the home because there were evacuation orders, perhaps other people had their homes destroyed, so they were all pooling together into one house essentially. Is that correct?
Yes, that's so basically, yeah. So a lot of at the beginning of the genocide, there was mass immigration from the northern side of Gaza to the center and then to the south after that. So basically, yeah, people were getting together so that we either live together or die together. A lot of them think like that.
So why do you say they were targeted?
Well, I personally witnessed and talked directly to healthcare workers that were captured, held captive for more than 25 days and tortured while they were held there, just being interrogated. Where were you on October 7? Who did you treat? Just being asked and tortured about their patients. And the stories that they tell independently are just horror stories, I talked to nurses from the Indonesian hospital, a physician from the Indonesian hospital another physician from the Indonesian hospital. All of them told me the same story independently on different occasions. How the hospital was directly invaded. There was shelling, bombing, how the top floors were demolished, how their colleagues were injured and hit and killed, and they were not able to rescue any of them. Anyone who would go up, they would be sniped. How they were held inside the hospital for a couple of days. And then after that, how when they were trying to leave in coordination with the Red Cross, how they were having to go through certain AI scanners that would look at their faces and identify their faces. If they were working anywhere near, October 7 in the hospital, they would be held captive to be interrogated about their patients. We as healthcare physicians, our oath tells us to treat whoever you get. So, if you get an injured person from regardless of their ethnicity, their religion, their race, you're supposed to take care of these patients, and you're not supposed to be tortured and punished for the service that you provide to humanity. And so I didn't only hear the stories from the news. I witnessed that firsthand when I was in Gaza. That, and when you see a dean of medicine being targeted, the head of orthopedic department being killed, when you see more than 400 or 500 healthcare workers killed everywhere in Gaza. So what else could this be if this was not targeting for the professionals and targeting for the healthcare workers?
Before Dr. Waleed, before I hear your reason for wanting to go to Gaza, I want to just tell you 3 things that I'm thinking about based on what you told me. So when it comes to targeting these homes, there was a report that the Israelis used an AI program called Lavender. And this program was used to determine the amount of innocent civilians that would be killed in exchange for potentially striking a suspected militant. And so basically, it's them sort of admitting that they're willing to commit war crimes and kill civilians. And they were willing to kill, depending on the type of target, up to 100 civilians per strike. So they would find a home. Let's say there's someone not even affiliated with the resistance, just a suspected tie. Doesn't matter how strong the tie is, just suspected. If that person is suspected, they track them, and they use Google technology, Amazon technology for this. There are American corporations providing this kind of technology. And the Israelis use that to track these people through drones, satellites, tracking their phones, visual recognition of their faces. And instead of attacking them in the act of resistance, which would confirm that they're actually part of the resistance, they just waited for them to go home at night. And when they would go home at night, they would determine how many civilians could there potentially be. Oh, their entire family, 20 civilians? Yeah, okay, we're willing to kill them. And they would, target these homes. The other thing it makes me think of is, obviously at this point we know that the objective in Gaza is to make it completely unlivable. They know they can't defeat the resistance. What they want to do is ethnically cleanse Gaza, and the way to do that is make it completely unlivable. And one way to make it unlivable, aside from destroying mosques, schools, destroy hospitals, and kill the medical care professionals. You can't live in a place where you can't give birth, you can't get health care. So that's something that just I'm thinking about as I hear this. It's pretty clear that they're being targeted. And the last thing I'd say is the Israelis have been using the excuse of October 7th to say, oh, these doctors are complicit, or the hospital is complicit in the act of October 7th, because one of the first places they took the hostages is to the hospitals themselves, and they were treated. But it's unfair, as you point out, to put these doctors in this position and interrogate them and torture them, because they have to provide healthcare, as you said, as part of the oath. So I don't want to talk too much longer, but I just want my audience to sort of understand these things.
I can tell you, while we were there, we would get these patients that would come with random injuries, and they would tell you that I was shot by a drone called the quadcopter. It's like a small drone that flies around, and they said, as far as we know, this drone could be on campus. It flies between houses, and it just automatically targets the victims. So we would get, pregnant women, we would get young adults, we would get children who were shot, all of these random shots in their abdomen, in their spine. They would end up being paraplegic, quadriplegic. They would get with amputations just because of this.
So these are quadcopters that actually shoot bullets.
Yeah. And then we would get sometimes there's every night there was explosions. We would hear the explosions every night. But, you would, we would say, you get a child, 7-year-old child, and they say, oh, this is the victim of the Muammar family, for example. The Muammar family was targeted. She's the only survivor. So the whole family was bombed, and you just get one or two survivors that they lost their parents, they lost their brothers and sisters, they lost everyone that they know. There's only one child who most likely will not survive because they have a lot of traumas. They have traumatic brain injury. They will need a lot of care, and because of the collapse of the healthcare system, most likely they will end up with an infection and die later.
Dr. Waleed, your personal motivation for going to Gaza?
My personal motivation basically is that I am a human being, and any human being who has some sense of humanity would not hesitate when the opportunity arises to go and help others. Regardless of the fact that I am a physician, I'm a human being. This started to crystallize back in 2008 after the so-called Operation Cast Lead by the Israelis against Gaza. And back in the days, I just tried my best to just go there and join any organization to facilitate the process. Unfortunately, I wasn't able to go to Gaza due to some logistic reasons. Instead, I went to Haiti when the earthquake hit it in 2010. So it's not about God. Well, I mean, we have a link that links us with the Palestinians, a religious, a cultural, and but most importantly, a human being kind of link. And that's why I chose to go to Haiti when the earthquake hit. From that date, I just wanted to go so bad until the opportunity came just recently, and I was fortunate to go there and provide some humble help. The fact of the matter is that anybody with a little sense of humanity will just go there, and if the opportunity allows. I had a lot of people who just approached me, and when they heard that I was going, and can we go? Like, can we do anything? Can we offer? I do some, basic CPR. Can we go? Can we join you? And it just reflects the mettle of humanity, of real humanity, and how it is. So, people were just approaching to give some money, give some help, whatever they could to get the process going, to feel that they are able to provide something to those people over there on the other side of the world. With that being said, I consider myself that I was, honored by this opportunity to go there and provide some little help, with all the scarce resources that were available over there. But, we were able to just join the convoy and just go there. It was just so, rewarding for us overall.
Yeah, it sounds very inspirational, obviously. It sounds like it's not just for Gaza. Obviously, as you said, there's a link and there's a dire need, but going to Haiti, it just displays, I think, your intent to help humanity. You should all be commended for taking this risk and endangering your lives. I want to ask now both Rana and Amani, what is it like to go from America and drop yourselves into Gaza's medical system in a war like this, in a genocide like this, and get to work? So when you go to work in America, you have systems, right? But then you go to Gaza, how does that work?
It's a collapsed system. There was no system. So truly there was no system. I mean, you basically create your own schedule on a daily. So I was dedicated. I created a wound care team while I was there because there was a severely injured. There was many injuries. So therefore, we created a wound care team while we were there with the help of many physicians as well too, and Amani helped out with us as well. But I want to point out there was no system. It's just a collapsed system.
So you would make your own schedule. Would you also just do your own tasks? You just show up to work, so to speak, and get...
We're part of a team. We are part of a team, but like I said, my background is critical care and wound care. So what I did is, due to the fact that we had massive injuries, so I created a wound care team with the help of physicians, and with the help of the local nurses as well too, train them to kind of advanced training, wound care training. So I provided that in the morning, and then in the afternoon we did some wound care in the OR. And then in the evening we help out because every evening we had mass casualties. Unfortunately, talking about targeting injuries, most of the injuries and most of the bombing happened when they would have the iftar, suhoor, or tarawih. So I would help out in the evening with the mass casualties. And then after that, I helped out with transfers. I also joined another organization to help transfer the injured children out of Gaza to seek additional medical treatments outside of Gaza.
For our audience members that are not Muslim, when she talks about iftar, suhoor, and tarawih, she's talking about the prayer times and the times of breaking the fast during the month of Ramadan. I just wanted to...
So
the bombing was like timed. Every single day, we were there for 14 days. At iftar time, which is the sunset time, there's a ground shaking bombs that rain on and shake the walls of the hospital. It was like we knew that's gonna happen. We're like waiting, timing it, and that's where people are gathered, most likely to be sitting with their families.
So this was like an act of psychological terror. The moment you get to break your fast and have some relief, instead of hearing the adhan and the call to prayer and being able to break your fast after a long day of not eating or drinking, you get bombs instead.
It was also because the family gathered during that time, so they could target as much people as they could. There was the time for people to gather and break their fast after a long day of fasting.
Do you mind just bringing the mic a little closer to you? She's good on audio, right? Okay.
I'm sorry.
Go ahead. Yeah.
The act of this, the description of this process of hitting people during iftar or during fajr prayer, you can tell it's an organized, it's an intentional process, because as Amani just mentioned, is that people are gathering during that time. This is a vindictive act. It's an act full of cruelty, of inhumanity, because by hitting people during this very time, you are killing more people with less effort than you would do when you hit them at different time of the day. So it doesn't need rocket science to understand it doesn't need a lot of intelligence to understand the concept behind hitting those people during those very special times of the day, other than for morale, but also for vindication.
Before we hop into the presentation, because I want our audience to understand the journey that you guys took, Amani, if you can tell us what it was like for you to be dropped into a system like Rana was talking about, or the lack of a system, and do your job.
So I took over multiple things there. So the first thing, I was in the physical therapy department, and it was a department of 42 people prior to this genocide. Now it's down to 5. And anywhere you walked around within the land of the European hospital, there were people injured and desperately in need of somebody to guide them and show them what kind of, splint, ortho, movement, whatever it is that they could do to just get better. They had so much motivation to be able to walk and do, but there was lack of assistive device to walk them. There was lack of medication. There was lack of nutrition, lack of vitamins, lack of follow-up. Even if you helped somebody with an external fixator for a fracture, there was nobody to follow up to take that, which caused the infection, and then more medical complications caused an amputee. It just, if anything, it was challenging. It was very challenging, I'm saying. And it was heartbreaking to see a lot of the injuries being children and a lot of women. And, as a mom, that was very touching to me. It was difficult to adjust to.
Yeah, I can only begin to imagine. It sounds like there are people that are dying unnecessarily or getting amputated unnecessarily because of a basic lack of resources. So if there was someone in the United States who had that issue, because of all the resources, there would be no need for an amputation, correct?
Correct.
Yes.
So we'll talk more about the European hospital and where it's at. Let's start, Dr. Bashar, if you can show us the beginning of the journey that you all took. So as I understand it, you all not only traveled yourselves, but you took supplies with you. Is that correct?
Yes.
So I think, Dr. Bashar, you said you took 16 check-in bags and you had to pay extra to take this onto the plane. Is that correct?
Yes, so me and my colleague, Dr. Jagbir, who was, he's in Jordan right now, both of us got 16 bags with us. And I can tell you, Rana got 30 bags with her.
30 bags? 50-pound bags?
70.
70.
Yeah.
So, and what was the bill to pay the airlines for that?
I paid
A lot of money.
for every extra 5 bags. I paid, I think, $750.
So,
I don't know the math.
we're, okay, so we're talking about almost $10,000, maybe more, just for bags.
Yeah, no, a little less than that. Yeah.
It's still quite a bit of money. Just to point out a clarification, if this were going to Ukraine, I'm sure the airlines would have waived that fee and would have been happy to provide that. But
They won't even waive £1 for us.
They took our power banks.
They took your what?
Power.
Oh, power banks.
Yeah.
They wouldn't let you check it in?
Well, we did, and then we got to Gaza, and we were trying to give them out to the doctors so they could use, because sometimes they had to use their phones as flashlight when the electricity went out. So we thought about that would be a good thing to bring, and they were missing from our bags.
Oh, so they removed it themselves.
Yeah.
Okay.
I mean, despite showing them a letter that we had from PAMA saying this is a medical mission trip and these are all donations.
So what was that process like? I know we talked a little bit earlier, but I'd like the audience to understand that even though, okay, so you're taking these supplies, which first of all should be provided by organizations, the government should be allowing it in, but they're not. So it's on people like you to go and take these supplies with you. And we're talking about all sorts of supplies, right?
Yeah, so basically, what happened, the calamity, the amount of destruction is just massive. And you can see that the international efforts are minimal on country level. So the organizations like PAMA or the other relief organizations, thankfully so, they were not prepared for this level of destruction, this massive destruction happening this quick. They don't have the resources, they don't have the personnel. So we as physicians, I'm going to that trip, the amount of prayers I made that I would like to make it to the trip, because, when I talked to the PAMA representative, they said we have more than 1,400 volunteers. That was like 5 months ago. So why would I be selected from 1,400 volunteers? So I just kept, hoping and wishing that, I need to make it happen. And whenever I was selected, I had a big, I was concerned that, listen, the amount of death is too much. Am I going to be of help to them? So I wanted to maximize the amount of relief that comes with me on this trip. So when you give someone a power bank, for example, or a solar panel, that's like a lifeline. We saw people over there staying in lines to charge their phone. Like you go there, they're like people, like there are car batteries on the side of a dirty road that has a lot of sewage. It's like flooded with sewage. And there's like a car battery where a shop or like a small, blanket with like multiple car batteries, and people stand in lines to charge their phones, and they can charge it 20%, 25%, and that's considered a privilege. You pay for that, like a couple of shekels or something like that, to be able to charge your phone. So whenever you give someone a power bank or a solar panel or a water filter, or anything, like even the suitcase, the suitcases, she got 30 suitcases, people would actually compete. Like they would say, please remember me to give me like one suitcase, because when they left their homes, they left with nothing. When these nurses, they were evacuated, they left with just their scrubs. So can you imagine living in a refugee camp where 100 people for 2 bathrooms standing in lines, and you don't have the infrastructure or you don't have your bedroom, you don't have your blankets, you don't have your clothes. So anything you bring with you makes a big difference.
If I may clarify one thing also, as far as the logistics, many of those organizations that try to transport supplies and humanitarian products to Gaza have all kinds of logistics issues at the border, because they can't just send a truck full of supplies into Gaza, because sadly saying the Egyptian side is never better than the Israeli side or the other side of the equation. They put all kinds of logistic hurdles against passing truck full of supplies. So as a matter of fact, we were tools to provide those supplies to those areas by just physically lifting those supplies with us, as Rana and Amani and Bashar mentioned. So we had just to take as many things as we could. And many of the things that you see in the bags, maybe just very simple stuff that you would not imagine. Why are these people taking all that stuff? You see a bag full of formula. Another bag that is full of just simple masks. Another bag, and it takes space, but you don't have any other choice. So you may be paying maybe $500 for 2 bags, while the inside or the content of those bags is only worth maybe $100 or $200. So, but you just have to do it this way, or else they won't get it.
Let me show you this video. I don't know if the camera can show the screen. You can see while we were riding with the bus to Rafah border, there were like at least 3 to 5 miles of trucks parking on the left and right side of the street, just waiting there. And when we reached the border, I overheard a conversation between the truck driver and the border control, saying he has been waiting there for 40 days. 40 days has been waiting for his truck with 40 days. So that explains why a lot of these aids, when it makes it to Gaza, it's already expired. Or
So as you understand it, why is there such a...
It's part of the equation, man. It's part of the pressure.
But who is it? The Egyptian side not letting it in, or the Israeli, or this is before the Israelis took the Rafah
on the Egyptian side. This is on the Egyptian side.
This is all on the Egypt side. Basically, the Egyptians will put some certain rules upon which you have only, you're allowed to pass only 10 trucks per day, or instead of 500, you're allowed to pass certain products through the Rafah border instead of allowing everything to go in as far as medical supplies. Now, we're talking medical supplies and humanitarian aids. We're not talking about like special products. So there's a lot of restrictions there from the Egyptian side in cooperation. And I hate to say that, but this is the reality, basically. There is a cooperation between the Egyptian side and the Israeli side to disallow certain things from going, to allow only a number of trucks to go every day rather than, and obviously this is never enough, under the crisis that is going right now.
And to make things worse, like look at this picture at the screen. We took this picture the moment we entered Gaza. We were full with joy. I mean, the amount of excitement I had and relief that we finally made it across the border to Gaza. We were so happy. So you can see us in the picture here.
So this is Rafah crossing.
This is Rafah crossing on the Palestinian side. And unfortunately, in the last week or so, the same site where we are standing next to the sign, there was an Israeli tank that destroyed this sign. And the driver of the tank was so proud, saying, "Oh, God, I love Gaza," and he just went over the sign. I have no idea what was his motivation, but they destroyed the same Rafah border where we crossed. So if we think the situation was dire and difficult when we entered Gaza on March 25, I can tell you now it's 3 or 4 or 5 times even worse because the border is blocked.
When you enter the Rafah crossing, who is on the other side? When you go from Egypt into Palestine, are they Palestinians?
There is a civilian authority there. They were like civilian, whatever, exterior or interior ministry employees that they received us and they stamped our passports. And we were, they also searched our bags. It was smoother than the Egyptian side, and but eventually we made it in. So there is still some remnants of civilian authority on the other side.
And now, obviously, it's controlled by the Israelis.
The border right now, based on what we hear from the news, is that blocked by the Israelis.
So let's rewind a little bit. Before you guys get to Rafah, you traveled to Cairo, correct? When you got to Cairo, if you can pull up a map, I just want people to understand, because also there's some interesting parts of the journey to Rafah crossing. I think people should understand this. And this is kind of new to me, hearing that it's actually part of the reason for the shortage of supplies is on the Egyptian side. There's a complicity there, it sounds like. So I don't know if you're able to pull up a map at all.
Bring the map of, I think you had a map of.
Just your basic map app, or you're not able to do so right now?
Yeah, so let me just find the picture.
Yeah, go ahead. Share something while he looks for this map.
So the distance between Cairo and the Suez Canal, where you have some tunnels that go underneath the canal to Sinai, is about 2 hours drive with the little bus or a little truck. When you cross the border, or it's not a border, it's actually you're still in Egypt. So when you cross the canal through those tunnels into Sinai, this is when things start to get worse, start to get very bad as far as inspection points and checkpoints, because every 50 miles or something close to that, you get a checkpoint. You spend like an hour or an hour and a half getting through a process. The distance between Cairo and Rafah, or Arish, I should say, which is that city just before we get to Rafah, if there is no crisis or things go smooth, it would not take more than 4 to 5 hours. In fact, it took us about
13 hours.
13 hours to get from Cairo into Rafah. It took us about 13 hours, and that's just because of the checkpoints that we had to go through throughout the.
And that was with a UN convoy. A UN convoy delivered you guys.
That's a fully UN convoy authorized to go and take that route. Everybody knows about it beforehand. So,
So even with that, there's still all this inspection and delay. So you all arrived in Cairo, you linked up with other organizations and doctors from different places, and the UN convoy transported you. You had to go through this tunnel, you get to the Sinai side, and you make your way to Rafah. And even though you're with the UN convoy, you have all these checkpoints. I'll put the map up myself, Dr. Bashar, in post. I'll edit it for you. But if you could show me the picture with the walls. I think when you guys got to Arish, is it correct, from Arish to Rafah crossing, there were walls erected along the ocean, is that correct?
Yes, there was a wall that extended all the way from Arish to the Mediterranean Sea. It was at least, I would say, 15 kilometers or so. And it was like probably, 12 to 16 feet tall.
And this is a wall, if I'm understanding, so it's the ocean, the beach, then the wall?
If I may explain a little bit of the geography in there.
Sure.
So Arish basically is the far northeast city of Egypt, after which Palestine or Gaza is. There's no other Sinai land beyond El Arish going to the east side. From the north part of Arish is the Mediterranean. There is only the water. From the south part, there is Sinai. And then from the east side, there is Rafah. The southeast side, there is Rafah and Gaza. So it is basically, when you have this wall, it is a barrier between Arish and Gaza from the Arish side, and that extends all the way down to Rafah. If we have a map, that would obviously be self-explanatory.
Yeah, I'll edit the map into the video and show the audience. Okay, so Amani, Rana, if you can explain to us what it was like going through the Rafah crossing from the Egyptian side into the Palestinian side after this long, arduous journey, 13 hours.
It wasn't like that. Whatever was left.
Sorry, yeah, this is the wall you were referencing, correct?
Yeah. So this is the wall. I mean, I probably Waleed, he's being Egyptian American. He can explain better, but this is the wall that we saw. And that I can tell you, the driver, he was a local from that area, and he was very upset about this. He said that this was very disturbing. Like, they lost their homes. They used to live right at the border with Gaza, and they lost their homes. Their homes were taken from them. They were demolished. They had to relocate.
By the Egyptians.
Yeah.
So in this area where that wall is, this is a Arish city where at some point of time, about a few years ago, there was a military operations by the Egyptian army to clean many of these areas from what they call terrorist groups on the Egyptian side. And they created this isolated framework of where they built the fence to just isolate the military side from the civilian side. This extends all the way to the Mediterranean and goes all the way down south to the southern border of Arish, so to speak. So it's just a way of isolating. This is not between, by the way, this is not between Gaza and Arish. This is between Arish and Arish. It's just two different zones.
Yeah, it's a buffer zone that they've
It's
created.
a buffer zone, exactly.
And it's
a
designed
buffer
to
zone.
apply more pressure on Gaza. It
Yes,
sounds like.
indeed. Yes, indeed.
So, Amani, yeah, going back to your experience crossing.
The first thing that really shocked me was the potent smell of the gunpowder, that was just filled in the air. That was the biggest thing.
On the Egyptian side, you could smell
No,
it.
this is from once you entered the border. Once now you're in the, the Palestinian Gaza side. This was the first thing you would notice, the smell. And then we picked our luggages up, and then we were transported by a medical vehicle to the hospital.
Were you guys afraid at any point? Do you instantly become fearful the moment you enter Gaza? Because they've targeted these medical convoys.
Honestly, for me, it wasn't a minute of fear. If anything, you worried. When you heard the bombs, you just worried, how many children is it going to be? Or how many families is it going to be? And you just rushed to the ER and waited. And if you waited more than half an hour, they have a saying that there's a big chance that family didn't survive.
Ahmad, the distance from the border of Rafah or Rafah to the hospital, in my opinion, was the little sketchy part, because this is when you're getting what is called the deconflicting arrangement with the IDF, who does that deconflicting order to allow convoys or anybody from moving from point A to point B while they're being while they're getting something like a promise that they're not going to be bombed. And this period of time, which is about 10 or 15 minutes, it's just very critical, because if you skip that time frame, you're basically vulnerable to any attack. So you have to follow the instructions dictated by the IDF, that you have to move at this time, and you have to have certain people. They know about everybody who is in the truck, in the convoy, who is going to the hospital. They know which route you're going to take. And if you sway from that, you're in trouble. So basically, and even with that happened, we all heard about what happened with the, what's it called? The World Kitchen.
Central Kitchen.
The Central Kitchen. And even though they got the deconflicting order, still they got bombed with all the guaranteed taken.
And recently, this UN convoy that went to the European hospital was gunned down.
It was.
And I'm assuming they stayed on the exact route they were supposed to take.
Absolutely.
Now, I want to draw a picture when you asked Amani how she felt when she entered the hospital. If you can show this on the screen here. So this gentleman here, I'm walking with this radiologist because I brought a couple of ultrasound machines with me. And I was walking to his office to hand him the ultrasound machines. Basically, you can see people on the right and left side of the, inside the hospital and on the hospital grounds. There were at least 12 to 15,000 refugees living on the hospital ground in the parking lots inside the hospital. You can see how people are sleeping on the side of the hallways. You can see behind each blanket here is a story of misery. Behind each blanket, there's a mom breastfeeding her kid who just lost her husband. There's a family of 4. Look at this blanket after blanket after blanket after blanket after blanket. And we could smell their life. We could hear their life. We could hear their babies crying. Every time I'm walking to the ICU, I'm not walking in clean hallways. I'm walking in this refugee camp. I'm having to cross the streets that are flooded with sewage water, and there's gunpowder in the air. I'm entering the hospital with these kids following me around, asking me for pieces of biscuits or bread, or saying they think that I'm because I was wearing this jacket. They would say, hello, give me a piece of bread, give me something, give me a chocolate, give me money, whatever. Hello. So this is how we would go to our working place in the ICU. You can see here in this, there is a barber trying to, do the hair here. You can see it's like a full refugee camp on the hospital ground. And despite that, we were living in that refugee camp, in that hospital, every single hour, there's some sort of ground shaking bombing. And the craziest thing is, whenever these bombs rain on the ground, shake the hospital walls where we were staying, they would shake, literally shake. And the kids, The children on the streets, they don't react. They're just so indifferent to that. They are desensitized to the point that, it's part of their daily routine, which was dazzling to me. I couldn't even process that.
I want to ask you now, tell us some of the scenes that you witnessed providing your care in the hospital.
Well, the injuries that we witnessed, honestly, that presented to us was like to the hospital. With the mass casualties, it was nothing that I've ever seen, honestly. It made me question, the type of weaponry that it was used on these innocent or civilians, people. The majority of the injuries that we witnessed, I want to say about 90% of the injuries that we witnessed in the emergency room that came to us, they were children and female. And they had like holes in their body. So again, it made me question the weaponry that was used. There were mass casualties at least twice a day that we witnessed. And like Amani listed earlier, if we heard nearby bombing, and within 30 minutes, if they don't come to the emergency room, it means everyone declares to be killed or dead. I just want to say that the injuries that were presented, they required, of course, the medical attention. They required nutrition. They required medical supplies and healthcare workers. And of course, the European hospital lacked all that. So with that being said, they're either turned into sepsis, which is severe infection, and they die, or they're turned into amputation because they lacked nutrition, they lacked medical care, and they lacked healthcare as well too.
Can you describe a scene for me where you said there'd be these mass casualties usually in the evening? So what was it like when you'd get flooded with an ambulance or cars or people just carrying bodies, and then all of a sudden the hospital, which is already packed, it sounds like, just gets even more packed and it's chaos?
So whenever we hear this, these bombings, everyone else would text each other to rush to the emergency department so that we can provide help. And you are having to walk, every single person there has a story of misery. So you're walking to the hospital, you're being stopped by random patients, an amputee, someone who's injured, just asking for anything you can help them with, or they have a question, they are afraid. Once you reach the emergency department, there's a mass casualty. I can say it's like similar to what's described in Judgment Day. People on the floor, there's blood here. We are intubating patients on the ground. There are random patients here that they don't have anyone to help them. There are a mother who's holding her child that was, had a head injury. There are kids that just wandering around, children like 5-year-old just wandering around. There's no one around to help him. Doesn't have a family, you're just wandering around. You don't understand why is this kid just walking around in that area. And maybe Waleed can tell us, more of what he saw over there.
Well, it was a sad, horrific scene overall. It is. I mean, you're dealing with a bunch of flesh rather than human beings, and they are human beings, but it's just they come to you in pieces. So when you come there, when you go to the emergency room, you have to kind of set your mind straight, because you have people who are semi-dead. You have people with agonal breathing who are, just about in the process of dying. And then you have people who are, maybe they'll die in an hour or something like that. So you have to kind of prioritize things and prioritize your care to kind of focus on who needs your care at the moment. Now, remember, even though that we are a group of doctors who gathered at the same time in the same area, but you have tens and tens of patients or injured people who just had blast injuries, and their injuries are way beyond your capacity as a medical provider to handle. It's just above and beyond any imagination. And I spent all my life in the trauma room. I get all kinds of injuries. but you're equipped with everything and you're expecting everything to go in a certain algorithm when you see somebody who is injured or badly injured. But over there, when you get some pieces of a human body, what do you do about that? You try to kind of put pieces together, try to see where the airway is. You try to explore where the anatomy is. And speaking of the anatomy, one of the things that just struck me and just hurt me, so bad, was when I saw two kids, probably 6 years of age, and I thought they were twins. And the reason why I thought they were twins is that they just looked alike, but they didn't have features. They didn't have anatomy. They were probably, they didn't have ears, they didn't have a nose, they didn't have an eye. They were just injured from before. This wasn't a fresh injury. They just came with their family, and they just were, the father or the relative was just holding both kids, and they're just walking, and I'm looking at them, and I'm trying to identify some structure in their face. Their face is just flat, and it just looks alike. So it kind of makes you feel that, well, wait a minute, what kind of humanity are we dealing with? This is like barbaric. This is sad. This is just heartbreaking, and you can't really you can't do anything about it. You just look and you just wonder. When I saw that, Feroz, our good doctor, was over there with one of our doctors. And I'm considering myself a strong guy. I consider myself because of what I've seen throughout my life. But when I saw this, I just couldn't handle my emotions. And he's like probably 20 years younger than me. He kind of came to me and he's like, Waleed, take it easy. It's all right, man. It's all right. Because, what I have seen is just something that I've never in my life seen before.
Usually here in the medical ICU, I take care of elderly patients, 7-year-old, 6-year-old, and that I love my job here. I love my job. When you provide service to someone, provide a line of life to someone, it's really satisfying. But over there in the medical ICU, on the ICU, it's like they turn multiple beds into ICUs. They have like 30-bed ICU, roughly speaking. You just move from a bed where there's like a 5-year-old with an explosive injury. Next to it is like a 7-year-old with a gunshot wound. Next to it is like a 14-year-old who had explosive injury. His abdomen is open. Next to him is like a pregnant woman who has hepatitis A because of lack of sanitation. Next to that is like a couple of children with diabetic ketoacidosis because they didn't have insulin complications because they didn't have insulin. And the saddest part is all of these kids with explosive injury after explosive injury after explosive injury. You're treating them like this child here on the screen had like 40% body burn. You're treating him knowing that this child will most likely lose his life in the next few days because of lack of basic resources. This sewage water that I described on the streets, there were flies landing on this sewage water, grabbing all sorts of bugs and flying around inside this refugee camp, inside the hospital, and landing on the wounds of these patients, bringing all sorts of bugs. I can assure you that the kind of bugs we were dealing with, and we can't treat with any antibiotic because we were, whatever antibiotics we brought with us, we were giving these patients and it wasn't working. They were just, dying because of sepsis.
Amani, Rana, do you want to chime in here? Are there any experiences that you feel the audience should hear? I know this is gut-wrenching, and this is hard for me to hear, but I think it's important that the audience listening, they understand what's really happening. Much of this I'm going to have to blur so it doesn't get deplatformed, but people can, I think, imagine based on what you're describing. So,
like Waleed just said, like you're in the field for a certain time. You see all kinds of injuries. So you're kind of like, a little immune to, of course you have the passion, of course you have the heart, but you've seen it. But when you're there, it's hard to comfort a kid that came in with the injury, and not only that, but have lost their home and have lost their family, and now doesn't have a future. And you don't know if this kid is going to survive to make it till tomorrow or not, because you're there to help, but you really can't do much to help.
Yeah, it sounds like you're just witnessing tragic story after tragic story after tragic story, and you don't know how it ends, but you can make a pretty good assumption.
I remember vividly when I was walking and I saw Amani, and I could read on her face that she was just standing there and she was just basically not happy at all. And I approached her that day and I said, Amani, what is it? She said, I'm not able to do anything to these people. I wish I could do more. But she's not able to do what she thought she was going to do. And this is basically something that we all shared, that we went over there to do certain things. And in our mind, we still have the medical system in place, organized. And you're thinking, oh, I'm going to a hospital to do such and such. But you're actually not going to a hospital. You're going to, Judgment Day. You're basically treating people during Judgment Day. This is basically how it is. I don't know if this makes sense, but this is how it was. We were just feeling helpless, even though that we're there with all the passion that we wanted to offer things, but at the same time, you're shorthanded. You can't provide except this much. So it was heartbreaking overall, but we had the passion to continue until the end of the mission. And, we all wish that we could go back and continue where we started, where we left off. Unfortunately, this is not going to be the case for, quite a while after the most recent events.
For me, I want to say that we keep saying hospital, hospital, hospital. But first of all, the European hospital is the last standing trauma hospital right now in Gaza Strip, treating 2.4 million people. But that hospital is no longer a hospital. That hospital was built to take care of 200 patients. Currently has over 15,000 people. It's a refugee camp. It became a living place for a lot of refugees in Gaza. That's number one. And then those people live there, they eat there, they sleep there, they cook there. And that refugee camp, which I would no longer refer to as a hospital because it lacks resources, it lacks electricity, it lacks internet, it lacks water, it lacks medical providers, it lacks medical supplies. There were many situations that I cared for patients with no gloves. There were many situations that I had no gauze to do a dressing change. In a normal situation, in any hospital that I worked at, and I worked at a traveling nurse throughout the States, I would have all my resources. There's a system, there's a ratio per nurse, 5 patients to a nurse, 4 patients to a nurse, 4 patients to a doctor. There was no such thing. It was all hands on deck. You help out, whether they live or die. You just helped out. So there was no hospital. To me, it was not a hospital. It was a refugee camp. And the amount of injuries that we received on a daily, we didn't have the medical staff to cover that.
Can you describe this photo for us?
Yeah, so
This looks like a graveyard.
yeah, so that photo actually has a story. So I went around the hospital, just like half a kilometer just around the hospital to explore what's out there, and the refugee camp just extends out there, so it spills out there. So inside the hospital, they were living behind blankets because the area is so dense. Right next to the hospital, there was a big piece of land that used to be planted with wheat. The landlord turned it into a refugee camp. So there were like thousands or hundreds of tents in that particular land. This graveyard, they told me that it started around 2 months ago. The first grave in that graveyard started 2 months ago, and it's already full by the time I was there. And you could tell that there's a tent next. The tents were literally next to the graveyard, like they're living. I don't know if you can call them living because they are living way below living standards. They were waiting for their turn. They were just living next to this graveyard, waiting for their turn. And we could see, you could see children coming and reciting Quran for their loved ones who were murdered there. They don't use the word die there. They don't use the word die. They never use the word die. Every time you talk, oh, what happened to that patient? They tell you he was murdered. He was, that 5-year-old Khalid was murdered, and they just move on. It's part of their daily routine when we were there. And one more thing I want to point out, these healthcare workers that we are talking about, a good portion of them, more than probably 30-40% of the workers that were working there were actually refugees themselves, who came from the Shifa hospital. It was burned completely to the ground. Came from the Indonesian hospital, from Nasser hospital, And when they left as refugees, they left with their clothes. So they were working on voluntary basis. They were not getting paid. They were working voluntary basis in return for taking a bed so that they can sleep safely inside, between quotations, safely inside the hospital. So these healthcare, every time you talk to a healthcare worker, one of the ICU residents, his father was bombed. The other ICU resident, his two brothers were killed. The other ICU resident, he was one of the survivors of the Indonesian hospital attack. Couple of nurses, also survivors of the Indonesian hospital. Another pharmacist from Nasser Hospital. And the stories that they tell you, the amount of trauma that they were exposed to is unimaginable. I spoke to two nurses who were captured for 25 days. When they tell you how their hands were tied, they were blind, their eyes were blinded the whole time. They were, sorry to say that, they were just like having to pee and poo in their place, the whole time. They didn't have access to time.
These are men or women?
These are a couple of men. The whole, based on the story that they told me, the whole interrogation was, who did you treat on October 7th? For 25 days. They were just being moved from a prison to prison to a prison. And you recently saw the report on CNN about the prisoners. Every single thing in that report is true based on the stories that I heard. And even worse, I'm even disgusted to tell you some of the things that they told me. The amount of torture that they were exposed to. And they were just regular civilian nurses, like my colleagues that I work with here in the hospital. Can you imagine being held and just being punished for providing your daily, for working, just being punished for working as a healthcare provider? That's why I couldn't process that.
And I would just like to add, a lot of these medical professionals are actual students that haven't graduated. It's just because due to the burnout and the lack of the professionals, they had to step up and they had to perform surgery or do whatever's necessary to save somebody's life. And they were just students.
Khan Younis.
It's in the most eastern side of Khan Younis. So literally,
southeast.
yeah. So the bombs, the cannon bombs were actually flying on top of us. Yeah, on a couple of occasions, I was able to film an F-35. The F-35s, because there was no air defense, so they.
Do you have video of this?
It's difficult to pull. I do have it on my phone. I can show it to you after the podcast. But
yeah, send it to me and I'll include it in this video. So what I want to ask, so this is one of the last trauma hospitals you said still available, but are there other hospitals in the city doing any type of medical work?
More like urgent care. I won't even call them hospitals. They're really not, because anyone that's severely injured gets transferred to the European hospital. So I would call them urgent care. I wouldn't even call them hospitals.
So what do you envision, what do you think will happen next to the medical system in Gaza? It's already bad, but you said from the time you went to where it's at now, it's probably 3 or 4 times worse. But it sounds like it's already collapsed, and it sounds like it could potentially be completely non-existent. So what do you think happens next?
One of my friends there, Dr. Amr, he's somewhere north right now. He was with us in the mission. He said that I feel like we're trying to put down fire with a spoon, just pouring water with a spoon. The only solution to this is to stop this genocide. Apply the international law. Just let them stop this. No matter how much aid you send, and you saw where the aid is being stuck there, it's not going to fix the problem. You have to stop the mass destruction, the mass punishment for the population over there. You have to stop that, and people should be held accountable. We saw a lot of these children that were targeted. We saw some children that with headshots. Why would you shoot a kid, a 5-year-old, in the head? Why would you do that? Except if you are a war criminal. So these criminals need to be held accountable, in my opinion.
So it is very simple. It's just ceasefire. There's no other option. We don't have any other option. The medical system and the health system was collapsed. It continues to be collapsed. It's not going to get any better. It is a collapsed system, and you can't fix a collapsed system just by giving more aid. It is just, it doesn't exist. So for us to be able, for anybody to to be able to establish some sort of a system to be able to treat that humongous number of patients and injured patients, you just can't do it while the assault and the aggression continues. You can't perform any of those operations. So the first thing is ceasefire, then we can see what we could do to hopefully do something. But while the status is in such form, nothing can be done under the circumstances, and more people will die, more people will just perish, and the whole world is watching. So we've been wasting the time, for 7 months and more, talking about things. Do you do this? Do you condemn this? Well, what do you think? Who's wrong? And nothing is happening. Cease fire. That's what you need to do.
I want to ask you guys 2 questions. Your understanding of, I guess, the way that people of Gaza are living now, because you describe seeing children not even reacting to bombs dropping, they're just kind of go numb, it sounds like, and they've normalized this kind of situation, which is incredibly traumatic. But Israel's objective is obvious. It's to make life so miserable that you either die there or you leave. So if they were to open the border in Rafah and say, you guys can go to Egypt, or they have this new port and they say, we'll let many of you go to Europe, we'll put you on boats and let you go. Do you think, based on what you saw, that people would leave?
Some would.
Some would.
Some would definitely would.
Yeah.
Some would definitely. I mean, I don't blame them. I don't blame them. I think a good portion of them will say, no, I want to die in this land. I'm not going to make my grandfather's mistake. I want to stay here despite all the suffering. But a lot of people will leave, because what else can you do? They made their life miserable there.
And Ahmad, just like we mentioned earlier about the bombs going on in a certain time during Ramadan, that did not stop the people from still gathering together. So you're talking about people of faith and strongly connected to their land. Some of them are very desperate that would leave because they're seeking a better life or like the safety for their children, or want to get just the medical treatment. But a big percentage would probably prefer to stay.
There was a gentleman, his name is Anas al-Najjar. He was in the press in Gaza after the start of the operations, or the aggression, I should say. And he was just reporting, like anybody else, doing his job, until he got a threat from the IDF. Somebody called him and told him that he needs to go and quit what he's doing and go and stay in the tent with his family. The problem is that he had little babies who were premature, and there was obviously no PICU, as we call it, or ICU for the newborns, and there was no health care that could take care of the babies. And he had no option but to attempt to leave across the border to the Egyptian side, for which he had to pay almost, so they charged him $5,000 for the little ones and $7,000. I'm talking about the Egyptian side now. Sadly, $5,000 for the babies and $7,000 for the adults, in order to allow them or to put them in a system.
Is this an official government charge, or these are individual soldiers pocketing?
So anything would not be happening in Egypt if it wasn't blessed by the government. So it is rumored that the company that is called Hala, which means in Arabic it means marhaba, or welcome, is in charge of these operations, and it's owned by this guy called Al-Arjani, who is a big shot in Sinai Peninsula, and also he's the co-founder with what's his name, Mahmoud al-Sisi, who is the son of the president. They both own this company, and everybody says that that money goes to these two guys mainly, but the government is sponsoring those actions. And it's just horrendous, because I know of a family. In fact, I just met with a member of the family last week when I saw them attending a soccer game with my kids. And one of the family members, she had relatives in Gaza but it was a big family, so they had to pay almost $200,000 for the entire family member to be able to take them and let them cross to the Egyptian side.
How did they pay for this?
They send money. They just wire money some way or another. They send money with somebody who's going there. They have ways of doing that. And the company, which is headquartered obviously in Egypt, accepts money from overseas or from anywhere else to allow certain people who are blessed. First, they have to be blessed by the Egyptian side, and before the Egyptian side, the Israeli side has to give the blessing for those people to be allowed to cross over to the other side. So some people just cross because they just need to cross because they don't have any other option. And some people, or many others, will have just to stay close to their remaining of the house or the tent or the belongings, and they just don't want to leave their land.
I want to talk about the famine now. I think a lot of people don't understand how the famine works, especially the Zionists. They've been lying about it. They spread propaganda, say, look, there is no famine. And correct me if I'm wrong. What I understand, though, you have the Gaza Strip. There are famines in different parts of the Gaza Strip. So because of the evacuation, let's say from the north, there's less food there. So there's going to be a famine there. So for many people still left behind, they're the ones starving. Or if they do get food, they're not getting enough calories to fight off disease and things like that. So can you talk to me about signs of the famine that you've seen, evidence of the famine that you've seen, and how it manifests itself in the patients that you're seeing?
Yes, there was a sister and a brother that were the Rafif and Rafiq. Rafif was 16 years old, and her brother was 14. They both came transferred over from the Shifa hospital. The Shifa hospital was targeted, and there was on lockdown. There was just for 14 days, nothing was able to go in or out. They were starved. I have a picture I'll send to you. You can post it. This kid looked very malnourished. He was so thin.
He was trapped in Shifa
Yes.
hospital?
Yes.
When the Israelis occupied it?
Yes, and then they transferred them over. As soon as they left, the Israelis left, they transferred them over to the European hospital. One of the things he's told me was, it was during Ramadan when I saw him, he said, I never want to fast again because I don't want to ever feel hungry. It's such a bad feeling to feel hungry. And if you ask me if I ever felt hungry, and he said it hurts to feel hungry for 14 days.
How does someone recover from starvation like that? Because I don't think you can just stuff them with food.
The damage that happens from starvation is permanent. Let me give you just some statistics. So before the wars, before this started, I think Gaza used to get around 500 trucks a day. 500 trucks a day. And that doesn't even cover these trucks, based on reports, a lot of what they carry is very highly selective. They wouldn't allow seeds, for example. You can't carry seeds because, that can help people grow their land there. That's just an example, right? You can't carry screws for orthopedic surgeries. That was on a normal day before this started. After this genocide started, let's say in November, December, they were allowing around 80 trucks a day. So let's say 500 covers 60 to 70% of what the Gazans actually need. 80 is one fifth of that, or even less. So that was on a normal day. Now, and that on some occasions can go even less and less, and sometimes they open it a little bit depending on how they want to control the what's going on there. We were witnessing, let me give you an example. A physician who used to work at the Shifa hospital. He got married in June last year. His wife got pregnant, and he just had a baby. He just had a baby 2 months ago before we arrived in January. Normally they don't ask you for help. You have to go seek them, tell them, hey, do you need help? What can I give you? What can I do for you? So I brought him with me to our dorm because I wanted to give him a power bank. I wanted to give him a suitcase so that he can use, because he's a refugee. When I gave him the suitcase and I gave him the power bank, he told me He grabbed me with a very muffled voice. Do you have some formula for my baby? I told him yes. I was like, yes, that's one thing I can do for you. So we went and we had a bag that had like some baby formula, and I was able to give him 2 cans of formula. And I can tell you, I could see the tear in his eyes. I'm talking about a physician who used to live, pretty good life before this, the nice house. Now they brought him to his knees to this point where he's, begging for a formula so that his infant can.
How long will a can of formula feed his child?
Probably a week.
Week.
So you gave him 2 weeks.
2 weeks, waiting for the next person that can deliver another line of hope for him.
The death march. A lot of people are talking about this concept of the death march now. So you're starving, you're injured, your will is broken, and the Israelis keep telling you to move. It sounds like there's more, when people think of the casualties, when they think of death, they think of you got shot in the face, you died in a drone strike, your home collapsed on your head. But it sounds like many of the casualties are just from basic injuries, not enough resources, you get infection, you die. Or you don't get enough food, you get injured, you're not strong enough to fight off the infection, you die. Can you talk about the concept of the death march and how the exhaustion can lead to death?
When you have a system or an area that is deprived from all the basics of life, water, sanitation, electricity, basic medications, hospitals, medical care, any of that stuff. And then people get injured. People get scratched by some cat or some minor injury. And then, they just need to clean it. So there's no clean water. So what happens? That area of their body gets infected. They can't eat. So they don't have their body doesn't have the ability to resist or to heal. They can't, that thing can't heal because there is a lack of nutrition, lack of medicine, because the bugs are starting to eat your wound, and there is a spread of that germ into your bloodstream, causing what we call septicemia. And now, from nothing, you become crippled. Now imagine this is as I just give the analogy that this is just a cat scratch. Imagine some serious injury or a blast injury or under the same circumstances when there are absolutely no resources. Any injury will lead to death. It's just very simple.
I can easily tell you anyone who needs dialysis is murdered by now. There was no dialysis in the hospital. We were getting kids who had diabetes because they didn't have insulin. They were on the edge of death, and probably a lot of them died in their tents without anyone noticing. We were physicians. We were staying in the dorm. We were 40 plus physicians for 2 bathrooms. And when you go wash your face, it's salty. The water is salty. If you have water, 3 out of the 14 days we didn't have water. The water is salty. Outside for the refugees who are living in the hospital, we're talking about 100 per bathroom. So how many of those? You can imagine the sanitation situation there. The hepatitis A. While I was there, I had like 5 patients with acute liver failure, complete liver failure, because of hepatitis A. You know how many cases of hepatitis A I've seen in the United States during my last 10 years career? 0. It's just related to basic cleanliness, basic sanitation. It's epidemic there. In 2 weeks, I saw 5 cases. 2 of them were pregnant on the edge of death, and maybe one of them died. So it is just, it's really heartbreaking.
It's 3:00 now. You guys want to go for another half hour? Because I know you said you have to go.
Well, it's not me that I have to go. We all have
Yeah,
to.
right.
Yeah,
right.
we all have to kind of get organized for the event. And
So
stuff like that.
let's do a closing statement then from everyone, and we'll wrap up.
Sure.
No,
There's so much more to say, obviously, but you have this event tonight in Tampa, and I think there's been different events either that you're part of or other doctors are being part of. And I guess the purpose of this specific podcast episode today, and also your mission, is to raise awareness about this dire situation. And it sounds like I mean, it's just a complete and utter catastrophe. So I personally want to thank you for the sacrifice that you've made. And I know you think it's not much and that you did nothing, but like you described early on how everyone wants to help. And like I just produce content and I have friends telling me like, I wish I could do what you're doing because you're helping in some way. I feel like I'm doing nothing compared to what you guys have done. And it's very hard for me to talk without like getting emotional and like breaking down here. So I'm not going to say much more so I can keep control of myself. But I just want to thank you from the bottom of my heart. I hope God rewards you for what you've done. And you know, if you ever go back, I don't care what the risk is. I'll come to and I'll bring my camera and I make sure the world will see this in 4K footage. The world needs to know what's happening. And so please do let me know the next time that you go. But I'd like to just closing statements, I guess, if there's anything that you want the audience to know.
Good.
I just want to say that while I was treating those patients, all I could think about is my own children. I imagine them being in that situation. And my heart would only like continue to break more than any, you know, ever. The lack of the nutrition, some of these children that I cared for were actually orphanage. And I truly want to people to think about no more than just think about the children that are in Gaza right now. They're either severely injured, they're either orphans, and not only they lack health care, they also lack education. There's nothing for them to do there. So I just want people to really feel for that. Like I'm calling out for all the healthcare providers and the parents. And I really wish that we could have ceasefire immediately.
Amani?
I just want to share something. So when we came back, I was very emotional for 3 weeks and I couldn't talk to anybody. I didn't want nobody asking me like, how are you? Or how was it? I just wanted to avoid those two questions. And I remember this one night while I was like middle of the night, I woke up to a very loud thunderstorm. And I sat at the edge of my, I was so disoriented to the place where I was. And it was just like a nightmare. Like I didn't know if I was back in Gaza and how I got there, because that's what it sounded like, the bombs that were going off. And then it took me a minute to get, you know, to realize that I'm home, I'm okay, and it's okay. But really, I'm not okay because that just triggered the feeling of how unsafe the children in Gaza are. And while I was there as a Palestinian American, knowing that my tax dollars are going to fund this did not make the situation any better for me. Didn't make me feel good at what I was doing. Because whether I like it or not, whether, you know, I do not want to participate in this as an American, but it's unfortunately that's the situation. So my mission is not complete. And even after I left Gaza, I'm still here to raise awareness. And hopefully, you know, people can listen and hear and it convince some people in some way that this is wrong. And to take action and know where their money is going.
Yeah, I mean, I gave a speech at the city of Gainesville, the city council, and we were trying to convince the city to take a resolution, a ceasefire resolution. We were like probably 80 of us supporting that, and we were like 10 that were against it. And those who were standing and saying, no, we need to keep firing, we need to keep funding, we need to keep funding this, whatever. I just want them to consider that, these our tax dollars that are really going there to fund this massacre is most likely, there's more than 90% chance that it will kill a child somewhere, a child just like your child, a woman just like your loved ones. It is causing a lot of destruction, and history will remember. The second thing is, I want you to know that the people inside Gaza, they know every time you stand up, every time you post something on social media, every time you stand up on a university campus asking for ceasefire or divestment or whatever righteous position you take, they hear about that and they appreciate that. It helps them in their perseverance and their resilience. It does help them to stand there and stay patient. So I want you to stand up. And these are very difficult times. I want you to know everything you do matters, and small things add up. And in the end, this will stop, and people will be held accountable. I'm sure of it.
Yeah, I think, I believe actually that, Ahmad, what you're doing is nothing less important than what we did or anybody who goes over there does. What you're doing is by spreading the word and letting all of your followers listen and see and observe. As an influencer, you have a very, very strong role in promoting, for this process to stop. In telling people that this is the right time, and it has been the right time from the beginning of time, that it needs to stop. We can't just keep following the rhetoric of those politicians who just keep arguing about irrelevant stuff just to distract us from the catastrophic events that have been going on for quite some time. So what you're doing and what other people like yourself are doing is nothing less important than anybody else's. We should continue to speak out. We should never stop. We should just keep on and on and on until this massacre stops immediately.
Very well said. Thank you all for being here today. I just want to point out one thing before we wrap this up and we let the audience go. This is happening, remember, because a people are demanding their independence. And it's unfortunate that this is taking place, but any group of people that want to achieve their freedom must pay a price. And the people of Gaza are paying an unbelievable price. And it's probably unprecedented in the history of human civilization. And so the people of Gaza, we have to show solidarity with them, and we can do that by, raising awareness and trying to bring an end to this. But through divestment, as you said, I think anyone listening to this, you have to hate this in your heart, and you can't leave it there. It needs to manifest itself into action. That action obviously needs to be informed, intelligent, wise, peaceful. Don't get angry and go to a protest and take it out on a Zionist and the media covers it and it hurts the cause. Think. And so take these, the whole time these people are telling me their stories here today, my spine is tingling, my heart is it really hurts to hear this. And I think it has always hurt me to hear this. And I know it's hurt so many people over the years. And so that's why I've dedicated a lot of my time and energy to producing content, because I believe passionately in the cause of the Palestinian people. They deserve their freedom and they're willing to suffer for it. And so we cannot let that suffering take place in vain. We have to support them in any way that we can. And so if you're a college student, you need to fight for divestment. If you are on social media, you need to fight to raise awareness. If you are a local community member, you need to speak to your council members. You need to speak to your congressmen and women. You need to donate your money, your time. This is a collective struggle, and it's beyond just the borders of Palestine. We as Muslims or as Arabs in the Middle East, whatever or just as human beings, collectively we must come together and sacrifice whatever we can. This will be a victory for all of us, inshallah, when we bring an end to this, and also, hopefully, achieve the liberation of the Palestinian people, whether it's in the next year or the next 20 years or the next 100 years. And so I hope the audience, really understands that and just renew your intent to fight, because we have to. There's a lot at stake. The last thing I want to say, is there a donate link to either PAMA or JAPA, or if you have your own personal GoFundMe the next time you do go potentially and you're going to take 30 bags to the airport, maybe the audience can help pay. So if there is, let me know. I'll include it in the description section of this video, and I'll also include your personal socials as well if people want to follow along your work. So thank you all for being here. And
Thank you for having us.
Thank you so much.
Thank you for having us.
Thank you.
Appreciate it.
Trust nothing.